A frequently asked question that I get is, Doctor, I want to make an improvement around my eyes. Is it surgical or is it non-surgical? And there's a lot to say on that topic. And the best is, of course, to discuss it with your individual doctor. But let's just go over a few of the concepts. Particularly with upper eyelids. As we age, we tend to notice a heaviness drooping down over our upper eyelid. And there's really two ways, or even more than that, that can be addressed. But basically, one way is to elevate the brow, because as we get older, the brow falls down and creates a heaviness over the upper lid. So we can, surgically or non-surgically, create a brow lift. And to do that, we either perform surgery, which can be done through a number of tiny incisions or larger incisions on the forehead, or can be done using Botox. So depending on how we inject the Botox, we can cause a nice lift to the lateral portion of the brow. We can't do that for the entire brow, but we can do that to give a lift to the lateral portion of the brow, and that can help some of the heaviness of the upper eyelid. Besides lifting the brow, we can go to the upper eyelid itself and remove some of the heaviness there. That's known as upper eyelid surgery or blepharoplasty, and that's commonly done through an incision that runs right here in the crease, slightly above, comes out to the crow's feet so it can get rid of some of that lateral hooding, and it just is surgically removing some of the excess muscle, fat, and usually skin that's really weighing down over the upper eyelid. Lower eyelids often are a telltale sign of early aging, and there's a couple of choices there as well. Sometimes the issue is surgical. There are big puffy fat bags there and some extra skin which have to be surgically removed. Another option can be to kind of try to blend that puffy fat and fill in the hollowness that frequently develops in an area we call the tear trough underneath the eye. By placing very gently and very specifically some filler underneath the eye, we can create a nice smooth appearance. There are several pictures on my website which show that. Using a filler like Restylane, we can get a good 6 months and sometimes even longer benefit to that area. Alternately, you can have the surgery, and the nice thing about the surgery is once that fat is removed, it's removed. Additionally, you can gain weight and lose weight, but for some reason, fatty eye bags don't respond to weight loss or weight gain. So no matter how much weight you lose, surgery might be the way to get rid of those fatty bags. Either way, taking care of the eyes will give you a nice, soft, gentle rejuvenation to the area that you'll appreciate every morning when you wake up and look in the mirror. Please feel free to call us or email us with further questions.